I'm Gerald Jerome from Towson University, and I'm here with Dr. Fanaroff from the University of Pennsylvania. Good morning, Dr. Fanaroff.
Good morning.
Dr. Fanaroff just presented the results of the Be Active study at the American College of Cardiology conference. The Be Active study is one of the largest, longest duration randomized control trials of behavioral strategies for home-based physical activity promotion. Dr. Fanaroff, would you give us an overview of this study and explain how behavioral economics informed the intervention strategies?
Yes, of course. So we know that physical activity is important for improving cardiovascular outcomes. It reduces all-cause death, cardiovascular death, heart attacks, strokes, hypertension, diabetes. And we also know that most Americans don't get enough physical activity. And then we also know that interventions that are informed by behavioral economics can improve physical activity, increase physical activity over shorter term periods, but we didn't know whether they affected physical activity over long-term periods. So that's why we did the Be Active randomized controlled trial. It was a randomized controlled trial of gamification versus financial incentives versus the combination of gamification plus financial incentives versus a control over a 12-month intervention and 6-month follow-up. And so what we did is we identified patients within the electronic health record at our institution that had an ASCVD risk score by the pooled cohort equation of greater than 7.5% or established ASCVD. And we sent them emails or text messages inviting them to participate. And the email or text message had a link to a web-based platform called Way to Health, which connects to wearable devices, automates the delivery of incentives and text messages based on customizable rules from the data that the device has taken. So once they navigated to the website, they completed the informed consent, they completed baseline questionnaires, and then we mailed them a Fitbit device. They wore the Fitbit for 2 weeks to establish baseline measures of physical activity, including daily steps and minutes of moderate to vigorous physical activity per week. And then once they completed that, we asked them to set a goal to increase their steps by 33 to 50%. And then we randomized them to the 4 interventions. In the control arm, participants just got a text message every day telling them how many steps they took the day before. Now, the gamification and financial incentives arms were both informed by behavioral economics. So I'll describe them and then talk about the behavioral interventions that really shaped them. So the gamification intervention, participants were enrolled in a game where we gave them 70 points each week. And every day they did not meet their step goal, we took away 10 points. And if they met their step goal, they kept 10 points. And they got a text message every day telling them whether they met their step count goal the day before and whether they kept or lost their points. And then every week, if they had more than 40 points, they moved up a level, and less than 40 points, they moved down a level. And they got a text message every week, too, telling them about that. And they identified a support partner who got an email every week telling them what happened to their partner in the game. In the financial incentives arm, we put $14 in their virtual account every week. And every day that they didn't meet their step goal, we took $2 away. And if they met their goal, then they got to keep the $2. And at the end, every day, they also had a text message telling them whether they met their step goal, whether they kept their money, and how much money they had left for the week. And then the combination arm got both of those interventions. So behavioral economics, just to back up a little bit, is a field of study that attempts to understand how people make decisions. And not only understand how they make decisions, but to use the way that people actually make decisions in real life to help design interventions that overcome some of the biases that lead people to make decisions that they would not make in sort of an optimal world. And people want to exercise. When you ask people that they want to exercise, they want to do more physical activity, but there are a lot of barriers to doing that just based on how we think and how we value things presently more than we value things in the future. So the intervention is designed to take advantage of that. So instead of having people focus on advantages way out into the future, they can, the reward is given every day. And then the second part of the intervention that I think leverages a key behavioral economic idea is the idea of prospect theory, which is sometimes called loss aversion, or the idea that we value things that we have more than things that we can get. And the classic experiment in this is that Richard Thaler and Daniel Kahneman, both Nobel Prize winning economists, gave a room full of college students coffee mugs. And they asked the college student, they gave every other student a coffee mug. And they asked the students that did not get the mug how much they would spend to buy the mug, and the answer was $2. And they asked students that had the mug how much they would sell the mug for, and the answer was $5. So it's just this example of we value things that we have, and that's why instead of having people earn points, in a gain-based way, we gave them the points so that they had something to lose. And then the third set of key behavioral economic ideas, this idea of status quo bias, and that's the idea that people sort of will continue along the same path and won't change their behavior. And the key sort of game design part of that is that the game sort of played in the background. You didn't have to do anything. You didn't have to navigate to the website. All you had to do was strive to achieve your steps. The participants were playing the game without really having to do anything other than try to walk more. So those are sort of the key behavioral economic concepts that informed our intervention design.
That's really interesting. So what did you find?
We found that the participants in the control arm actually had a pretty substantial increase in physical activity. So they increased physical activity by about 1,400 steps per day over the 12-month intervention, which is a lot. But participants in the gamification and the behavioral and the financial incentives arms both increased their physical activity by about 500 steps per day more than that over 12-month follow-up, so by about 1,900 steps per day from their own baseline. And participants in the gamification plus financial incentives arm increased their physical activity by about 850 steps more than the control arm, so about 2,250 steps more than their own baseline. So these were substantial increases and that were statistically significant. And then over the sort of 6-month follow-up after the intervention, some of these gains tailed off, but even still, there were substantial gains in the gamification arm by about 1,700 steps per day versus baseline, and by almost 2,000 steps per day in the gamification plus financial incentives arms over that 6-month follow-up after the intervention was taken away.
Yeah, those are really amazing findings. Congratulations on that.
Thank you.
For people who are designing physical activity programs, text messaging is pretty standard right now. What advice do you have based off of these findings and the gamification? How do these results inform future physical activity promotion programs?
I think that there's a large base of behavioral economics research out there now, and we know a lot about how people make decisions in the real world and how people how to motivate people in the real world. And I think that what our intervention here shows is that taking advantage of some of those ideas to design an intervention is effective and can help people persevere in the intervention and can make an intervention that really helps people change their behavior and have lasting effects. And I think that the gamification intervention in particular is, to me, particularly interesting and compelling because the costs beyond just providing a Fitbit are pretty minimal. So financial incentives, I think that there's always the question of who's going to pay people to walk, to get physical activity. And I think that, but I think that our study showing that gamification is as effective as financial incentives alone really says that, if you design a good, simple gamification intervention, and I think that simple is also key because, the people that we really want to do this are people that may not be so technologically savvy. But a good, simple intervention can have large and durable effects on physical activity, and as long as you take into account some of the things that we know about behavioral science.
Yeah, that's a great point. It's so exciting to hear about this study. What practical advice do you have for healthcare providers who are encouraging their patients to be more active?
I think that doing a gamification intervention with your patients is probably a step too far. And I think that that's going to have to come from health systems and insurers and other stakeholders to design interventions as sort of to help with population health. But I think that one key takeaway from our study is that the control arm had a substantial increase in steps. 1,400 steps per day over a year is a lot. That would have big effects, if you look at the observational data on patients' outcomes, if they can achieve that level of increase in step counts. And the control intervention really consisted of two parts. It was goal setting, and then it was the idea that somebody cared and was watching your steps. So when I think about this, and to back up, not just goal setting, but goal setting in a way that is patient selected and patient centered and attainable. So I think there's a lot in the media about how many steps you should take and how much physical activity you should get. And the CDC guidelines are actually pretty clear, where they say that we want you to strive for 150 minutes per week of moderate to vigorous physical activity, but some is better than none. More is better. And if you actually look at the association between physical activity and outcomes, it's the people that are not moving, that get a little bit of exercise, that are really getting the biggest bang for their buck. So when you see your patients in clinic, most people have some device that tracks their steps. Most smartphones do. A lot of people have wearable devices. So you can say, let me see, how many steps per day you take on average, and let's try to set a goal to increase that by some amount that's meaningful to you. We use 33 to 50% in our study, and I think that's a reasonable place to start for many patients. And then say, when I see you next in 6 months or 3 months or a year, we're going to look at your step count and see if you've increased it up to your goal. And I'm going to write your goal in your chart, and we're going to see if you can do it. And I think that doing that is a reasonable approximation of our control arm, and is something that everybody can do today.
That's some great practical advice. Dr. Fanaroff, thank you for joining us, and congratulations on a successful trial. For those of you who are interested in more details, the main results paper is now available in circulation. Thanks again.
Thank you.